So, Carlin, thanks so much for joining us today. My first question is, so St. Paul's is the first hospital or the first hospital to have in-hospital overdose prevention site. Why is that? Why was that so important to St. Paul's to have this available?
Yeah, St. Paul's, I mean, we were fortunate that we did have a peer-run overdose prevention site outside of the hospital for a few years. And they told us it wasn't run by Providence, but they told us that they were going to be moving. And we knew that while they supported the community, a lot of our patients did access that service as well. So when we found out they were moving, we realized we needed to make sure there wasn't a gap in that service. And so we sort of put something together quite quickly when we found out they were moving, and being realistic of knowing how substance use disorders work, and that people, when they're admitted to the hospital, are not always able or wanting to stop using substances at that time. And many of our patients continue to use substances while admitted to the hospital because they're trying to manage their pain and withdrawal. And despite what we may be able to try to give them as a medication alternative, it's not really cutting it with this super concentrated and toxic supply that's out there now. So knowing the reality of what's happening and people continuing to use substances, we felt we really needed to create a safe place for people at St. Paul's with substance use disorders and support them to use safely or as safe as possible, and hopefully be able to stay in hospital to complete their treatment as well.
And so, just for clarification, for my sake, Carlin, so this overdose prevention site that you have on property is for those who are currently admitted into hospital, or could people from off the street also come in?
Yeah, so it's for patients of the hospital, but it doesn't
Okay.
have to just be someone who's admitted. So
Okay.
a patient who's maybe accessing care for outpatient services or coming in for like a diagnostic test or heading to the emergency department, perhaps, we would support anyone who's sort of considered a patient, but often they are admitted patients.
Okay. And you kind of addressed this, but would love to circle back. What is the goal then with this OPS? Is it to eventually get people off drugs, or is it, as you've talked about, to help people stay within treatment and have accessibility to a safe space where they could take drugs if they need to in order to continue whatever their treatment is within the hospital?
Yeah, I mean, in an overdose prevention site, the primary goal is really preventing death from overdose related to substance use. So that is the primary goal. A lot of the other goals are around reducing harms associated with drug use. So we are able to provide education and sterile supplies to people. We offer drug testing. We can provide take-home Narcan kits and training, and creating a nice clean environment for someone to prepare substances where they're not feeling rushed and not feeling like they have to use quickly in, say, a bathroom because they don't want someone to come in and find them, or in the alley near the hospital. So it's really more around preventing harms, mitigating risk, supporting the patients. So I wouldn't say that a goal of an OPS is necessarily to get someone into any sort of treatment. Because I mean, the services that we offer at St. Paul's really for substance use disorders, I see the OPS as one part of that continuum, and that's for people who are still using substances. We want to keep them safe, but we do offer other services for people who are interested in treatment or abstaining from using substances. This is sort of just that, maybe the other end of that.
Right. And what's kind of been the feedback that you've gotten in having this on site?
Yeah, we've actually had a lot of organizational support around this. And I think, of course, there's going to be some concerns when we first opened or when we let people know that we were opening, because it is like a novel idea. It is a new system. So there was concerns around how this was actually going to work. Was it going to make other patients uncomfortable? Were patients even going to want to seek these services? So but I think now that it's been up and running and has been shown to be successful, I believe that people, even maybe who were a bit hesitant, are quite supportive now.
And in one of the articles I read, there's a trust aspect to this with those who decide that they're going to come into the OPS, just trust that that those that are there, like yourself, Carlin, are looking out for their best interests, and just maybe talk about that level of trust that you have to gain with those that use the site.
Yeah, I mean, it's even more relevant, I think, for our site because we are a nurse-led site
Mm,
where I'm not sure if you know, but in the community, most of the OPSs are run by peers.
mm,
So they're a bit more low barrier. And I think just that peer-to-peer contact creates a little bit more trust right away. But for us being nurses working there, I think it can represent a system for some people that has historically stigmatized or
mm.
judged their substance use. So we are aware of that, and we do work hard to work in a trauma aware way, create a welcoming environment, be very non-judgmental for people because yeah, like you said, I mean, if someone doesn't trust the staff there to not judge them and not stigmatize them, they're not going to want to come to use the site.
Mm.
So that was very important for us, definitely.
In the time that it's been open, do you think lives have been saved by having this on site?
I do. I think. I mean, we've reversed or managed almost 100 overdoses since
Mm,
we've opened. Um, not all of the varying severity of the overdoses, but a lot of them requiring naloxone to reverse the opioid overdose. I do worry that if that wasn't happening in that space, it would have happened in like the public bathroom there, because that
mm,
is historically somewhere where people have gone to use substances in the hospital, or on the units where they weren't being, fully monitored at all
mm.
times, or leaving the hospital. So I do think at least has reduced a lot of harms associated with a severe overdose because the staff were able to respond immediately once that person did experience the overdose. Yeah.
So, Carlin, you mentioned that there are other services within the hospital if someone wanted to go in the direction of treatment, getting off of drugs. Is that communicated or explained to those when they come into the OPS, or is that brought up in any sort of conversation at some point?
Yeah, I mean, I don't think it would be something that the staff would necessarily prompt out of an initial conversation, but we do tend to see people for regular visits. So as the staff maybe developed a rapport with someone or got to know them a little bit better in casual conversations, and that came up, there's definitely that opportunity to let them know about some services. So, I mean, if they're not admitted to the hospital, and they were seeking the OPS as an outpatient, we do have the Rapid Access Addictions Clinic at St. Paul's. So that would be somewhere where the OPS staff could recommend they go. And that's just as a drop-in service. And they can receive support around maybe getting into treatment or starting on some sort of opiate agonist therapy, medication to help with their substance use disorder. So there's that option if someone's an outpatient. And if they're an inpatient, most of the patients who are seeking support at the OPS are already followed by our addiction medicine consult team at St. Paul's. We're really fortunate to have that. So they would really be the ones, more the addiction medicine team, sort of navigating that conversation with people around if they're wanting to stop using substances. Whereas the OPS would be more just there to support. And if the conversation went that way, they could offer these suggestions, but it wouldn't be something that would really be prompted there. We don't want people to feel kind of pressured coming in, like that's the expectation, because it's not the expectation for people to come.
And maybe just for the sake of clarification for me, Carlin, this is my last question. There are hours for the OPS. You're open from, I don't know exactly what your hours are, but what does that mean for if someone wants to go to a overdose prevention site and you guys are closed? What happens then?
Yeah. So that's a really good question, and it's an ongoing challenge and really something that we're focusing on. So we are not open 24 hours, and a big goal of ours is to create some sort of 24-hour safe consumption service at the hospital. And I don't know if that would look like the OPS being open 24 hours or some other sort of creative system. But I mean, the reality is people who are using their substances in the day don't just stop at 8 o'clock when we close. So it is definitely a major gap in the service currently, and something that we are very aware of and trying to work on. So currently, if someone overnight is using substances, the OPS isn't open. So we do have limited options. There are some community-based sites that are fairly close to the hospital that have extended hours. So that is an option. And we always take a risk mitigation strategy. So if someone's leaving the unit and we think that they're using substances because the OPS isn't open, we'd always have a nice, an open conversation with that person and ask them, is there anything else we could do to support you? Are there medications that we could offer you? Make sure they leave with a take-home Narcan kit, which we can provide from the units as well, and encourage people to go out together so that someone's not using alone if they're off unit.
Awesome. Thanks, Carlin, for your time today.
Yeah, thank you.